Hello, everybody. It is lunchtime on a Friday, nice sunny Friday. I hope you are having a good day. Thank you for coming in and joining us for this webinar about the Bright Lights Nominations Review. We still have a few more people signing on to the webinar, so I just want to do a few housekeeping and then we'll get into the webinar proper. So for today's webinar, we will be going over the nomination review process for the AFHTO Bright Lights program. We'll ask a few poll questions, and I'm hoping my part of the presentation will take about 20 minutes to half an hour max to give you lots of time to ask me any questions that you have. We will be opening it up for discussion at the end of my presentation, but if you have any questions throughout the presentations, please do send them in through the questions panel to the right of your screen. You have your control panel. You can submit questions or raise your hand if you have any questions. I have Paula in the room with me, Paula Myers. She's our membership conference and communications coordination queen. She'll be taking all of your questions and answering anything along the way. And I will be your presenter for today. My name is Sal Abdulzarai. I'm the Membership Engagement Lead with AFHTO. So again, if you have any questions at all throughout the presentations, please send them in through the questions panel. So for our hour today, or again, the first half hour of our meeting, I will go over what is the Bright Lights program, the Bright Lights Awards, take a look at our evaluation and review criteria, the process we go through, and then go over some nomination writing tips and how to fill out the online form, just so that you have a complete nomination, and then open up the line to any questions that you might have, if I might have missed anything, or if you have any specific questions about your team and the nomination you'd like to put forward. So our first point of action is I'd like to get a bit of an idea of who we have on the call. So the first question is, have you ever submitted a nomination in the past? Yes or no? Okay. So we do have a few of you who have submitted in the past, but for the most part not. Thank you. And next poll question is, how many are you planning on submitting a nomination this year? Are you planning on submitting one nomination, more than one for your team? You're thinking about it, but you're not sure what to focus on, or you're not sure yet, and I have to do a good job of convincing you to submit a nomination this year. All right, there's a couple of people. There we go. So as you can see, most people are going to be submitting a nomination, and I guess you're looking for tips on how to do that. And everyone else is, I'd say, one person each for not sure yet, I'm thinking about it but don't know, or more than one for your team. All right, thank you. That helps me get an idea of who we have on the line. So the AFHTO Bright Lights Awards program, it recognizes leadership, outstanding work, and significant progress being made to improve the value delivered by interprofessional primary care teams across Ontario. That is the description we have posted everywhere. What does that mean? For us, from an AFHTO perspective, that means our Bright Lights Awards recipients are innovators. They are doing, they're creating change within their teams, within their communities, and for their patients that advance interprofessional comprehensive care, and this can be small changes or big ones. It really is looking at innovation at all levels. They are team players working within their interprofessional team, with their patients, with their partners in their community. So team players at a broad level, and demonstrating impact can show their work is benefiting the health system. So we really want to be able to show outcome and see the results of what initiatives and innovations that the nominee has done. This year we'll be presenting 8 awards in 7 categories. Thanks to our very generous sponsors, we have 8 awards that will, 8 education grants that will be given out. They're valued at $3,000 each. The 7 categories follow in with our conference themes. And the overall conference theme this year is Leading Primary Care to Strengthen a Population-Focused Health System. All of our award categories fall in line and build towards that overarching theme. So we do want everybody, if you're considering your nominations, to think of that theme and your category, and look at how your innovation or your nominee has really done some innovative work to advance that leadership. The Bright Lights Awards will be presented at the awards dinner during the conference on Monday, October 17th. Everybody is asked to be there. We do not announce the award winners before the conference or before that dinner, and it will be at the Western Harbour Castle in Toronto. If you need any other general information, there is a hyperlink here. You will be getting a copy of these slides after the presentation. So how are award recipients recognized? First, you get a beautiful plaque to post in your office and or clinic. Again, the $3,000 education grant from our wonderful sponsors. You will be featured in a video that is shared at the awards dinner and shared online again afterwards. And I have a little note here that we need photos from each nominee so that to develop these videos. And what we do each year, for those of you who may have been at the awards dinner, is show a video and really look at the accomplishments from all nominees. So all nominees are featured in these videos to then go through and announce our award winner and give a bit more description about what they have done to be to be recognized. And if you're curious or would like to see what those look like, we have all of our past videos from last year are posted online. There's a link there for you to go in and see them. And last but not least, we also, the Bright Light Awards encourages media coverage for each of the winning teams. AFHTO supports each team by giving a press kit with a description of your accomplishment, some contact information, and so on and so forth, for each team to then go out to their local media, whether it's print or radio or local TV network, whatever that might be, so that there's a story that they can build off of. And each year, and more each year, each team is getting some media coverage. So now to dive into the detail of the nomination form. There's how do you submit, and I've summarized it into 4 sections. One is to really look at your category, review the nomination category to see where your nominee fits. Second is to review our evaluation criteria, and I will be going through both of those in detail. Complete the online nomination form and submit all supporting documents by July 12th. And then support the photos. It says supporting documents again, but it's really around the photos for us to develop the awards videos and recognition material for the conference. We need all of those by July 29th. And there's some notes here around high quality photos that we are looking for at least 1, but really 4 photos from each nominee. And they have to be high quality photos, and they can range. They can be, we love smiling faces, so we love to see the team, the nominee. We like to see where you're working, any patients, if you have the permission to take their photos, or anything else is actually showing you working and doing the work that merits recognition. And we also need a signed statement about statements to release the photos for AFHTO's use, and the deadline again is July 29th. Looking at our evaluation criteria, it looks like a lot on the page. There's a lot of text here, but I want to go through it just one by one. The review committee will get your nomination, and it's a 1-page form where you're asked to fill in about 10 questions. You have 100 words to fill in each, and again, I will go through this. But they will be looking at how you filled it out and rating your nomination on a scale of 1, very low, to 5, to what extent your nomination does each of the following. So first is reflect significant achievement within the award category, and I will go through those categories. That is a big part of where in the past, some people who've nominated themselves don't feel like they've been properly recognized, and it could have been because they were in the wrong category and It is a self-selection process to say, this is where I fit. Exemplifies innovative thinking and leadership, recognizes and addresses the needs of your local population. So this could be addressing access or barriers to care. The rurality here is a bit of a misnomer, but it's more about how do you address the needs of your local population within your local context and the resources that are available to you to be able to improve care and do something better for your patients. Is backed up by evidence of impact. Is sustainable with potential for continued improvement. So that your innovation really has the chance to be to succeed in the long term. Offers significant, useful, and relevant learning opportunities of resources to primary care teams. And this is coming towards spread, that it's sustainable. Somebody else could be doing it and learning and actually improving care in their own local context. And the very last bullet there is being spread and adopted more broadly, and that is looking at what is the nominee doing to foster that spread and share the learnings across primary care. And I skipped over this one other new evaluation criteria, and it's how well the nominee reflects patient and or caregiver involvement. So it hasn't mentioned, but our nominees can be teams, can be programs, can be individuals within that primary care, within the AFHTO membership or partnership with AFHTO members. And we need to see how well that each of those, whether it's an individual, a program, or a team, has considered how patients and caregivers should be involved in the process. So those are the evaluation criteria. Paul, I'm going to pause if there's any questions that have come in. Okay. So, having gone through the evaluation criteria, I'd like to ask, for those of you who are thinking of submitting a nomination, what stage is your nomination in? Are you still looking for ideas of what could fit? You've got something in mind but haven't started writing yet? You've started a draft, or you finished a draft and now you're looking for tips on final edit, or you've already submitted your nomination? And anybody who picks that, I know you're lying. We don't have any submissions at this point. They've only been open for the last week. Okay. I believe that's everybody. All right, so I'm glad you've all admitted nobody submitted their nominations yet. One person has started a draft. Most of you have got an achievement in mind and are really looking to see where and how it fits and how to recognize it. And then you're still looking for ideas, somebody else. So that's great. I hope that I'll be able to cover off all of those, the types of things that you are looking for. And please do continue to ask questions or send in questions as you have them. So I'm going to start going through the tips on how to actually start writing your nomination, and going through first the general tips, describing the award categories, and then what do you actually need to write? So your title, your description, showing your evidence of impact, sustainability and spread, how to include and show the multiple perspectives and voices and supporting materials, and also how that relates back to that evaluation criteria. So on the screen in front of you is really around our general tips for writing your nomination. And first and foremost, focus on building a story. Your nominee has done amazing work. You can see the results, you can see the impact they have on their patients, their teams, so on and so forth. But you need to be able to share the story with our review committee. So a good way to do that is to include a variety of voices. You have the opportunity to share, to submit additional materials above your form. So if you're having testimonials from patients or partners or whatever that might be, bring in those other voices, because it also helps share how impact is perceived. Understand that the everyday counts. So when we're looking at team collaboration or leadership or very internal types of innovation, a lot of teams don't necessarily see that as being the the brightest innovation that is going to be recognized, but that's not the case. If you're able to really show that this thing that seems like common sense, but you just hadn't done it for years ahead of time, and it's actually helped your team immensely, bring out that story. Talk about what it was, how difficult it was before, or what has changed, and what was the impact of it. So really starting from that side of it. And also that you're not too small or too remote for your voice to be heard. And I cannot stress that one enough. I know each year we have some in the evaluation or in the feedback we get from the Bright Lights and even the conference, the AFHTO conference program, is that we don't hear from enough of a variety of voices, or the same people keep coming back to submit each year. And a big part of that is to do with where we get the nominations from, and I really want to get as many nominations as possible so we can really feature everybody's voices here. Each year for Bright Lights, we get about 50 nominations. This is in comparison to the AFHTO conference program call for presentations, where we get about 170. So everybody's very happy to share their learnings and insights with their peers and their colleagues, but sometimes bringing it up to a point of actually saying this was an innovation that really needs to be recognized, there's a lot, I get a sense that there's a lot of people that shy away from that. So I really don't want to stress, really want to make the point that everybody has a voice and should be able to recognize the innovations that are out here. When you're looking at building your forum, take a look at past award winners. We have the descriptions posted up on the website, and I'll share that link afterwards, and look at the videos and look at the types of innovations. And the way we've presented them are really looking at what the award committees saw as the core to the innovation. So that might help spark some more ideas or help you frame your own innovations in a different way. And all of the questions in the online form have a 100-word limit. Please stick to that. You do have the chance to send in supporting materials, but you want your nomination form to build up a story to say this is the innovation, here's the evidence and the impact and how we're building off of it. And if you're ever unsure, check in with us. Paula and I are always available to answer any questions that you have. I believe most of you have our contact information. If not, it will be shared, and we'll be following up with everybody on this call afterwards. So the very first thing you're going to do is pick your award category. And for those of you who are familiar with the AFHTO conference, you're probably familiar with these categories already because they're the same ones as our concurrent streams of the conference. There are 7 of them, and I will go through them in detail here. So the very first one is planning programs and fostering healthier communities. And this is looking at expanding care beyond your roster patient populations to your entire community. This is a huge push in with Patients First and just the agenda for primary care as a whole. So we really want to look at the teams who are already doing that, already expanding access, or already integrating their community into the care that is being provided. So in the nomination guide, you have full descriptions for each of these categories with some ideas of what are the specific things that the review committee will be looking for. So I do stress that you take a look at the descriptions. Number 2 is optimizing access to interprofessional teams. So that's building a little bit on that first one around planning programs for your community. This one is opening access and creating more equitable access for other patients and for everybody in your community. And you'll see in the description that right now, the way AFHTO has presented this is we have a lot of question marks as to how this is being done. So we really want to hear from the teams who are starting to do this, looking at the pilot projects or partnerships that they've developed that are helping to advance this access. And these nominees will really be showing the way for most of primary care teams. Third is strengthening collaboration within the interprofessional team. So this is looking internally at the team culture, at building up interprofessional practice and enabling optimal scope of practice for all team members. The fourth category is measuring performance to foster improvement in comprehensive care. So for everybody who's an AFHTO member, you know quality improvement decision support program and data to decisions report is really focusing on getting access to the measures, getting meaningful measurement out of primary care. But that's always towards an end goal of improvement. So if you can show the nominee can show what they've done with the measures they've gained access to and how they've actually used that for improvement, that is what we're looking for in this category. Number 5 is coordinating care to create better transitions, and this is looking at health links or partnerships or integration initiatives that are moving patients through the continuum of care. I believe that says a lot. I know this topic has come up quite a bit, and for all members, again, look at the description if you're looking for more specifics. Number 6 is leadership and governance in a changing environment, and this is, again, looking internally at the leaders within teams. So these are clinical leaders, administrators, board members who are able to take a look at their practice, innovate within their team, but also look broadly and look at the system and how does that fit in and how does that connect, how does your team connect into the broader system and the change agenda that is coming out of the patient's first act. And last but not least is clinical innovations to address equity. So every year we have a category that really focuses on clinical innovations. This year, since our overarching theme is around population planning, this one is looking at addressing equity. So what are those clinical innovations? And we're looking at mental health, palliative care, diabetes, chronic disease management, and all of those functions, but looking at how is the team working together, working with the patient, and working to address equity. I'm going to pause there and ask if there are any questions around these categories. And please do feel free to send them into the questions panel. Oh, one hand up?
Oh, no.
No?
Or raise your hand.
Or raise your hand if you'd like to ask the questions out loud. Okay. So that's basically, at this point then, we ask the poll of, do you think your nomination in mind, or any one of them if you have more than one, fits in with one of these things? And it's yes, perfectly, kind of, it touches on some of the key points, not sure yet, or no. A few people starting to send in their poll. Okay. So a few, yes, perfectly, others where kind of it touches on some of the key points. So for those of you who say kind of and it touches on some of the key points, then that's where I'm going to put a bit of a challenge to take a look at your nomination and really dive into that the description for your category to pull out some of those elements. There's always a different angle of looking at the achievement or the nominee, and we can help answer any questions that you might have, but there's always a little bit that you can do. Sorry, Paula has a question.
Sharon would like to...
Okay.
Sharon has asked if you can explain categories 3 and 4 again.
Explain categories 3 and 4 again. Okay. Where we're looking at, so category 3 was strengthening collaboration within the interprofessional team. So that is looking very internally at how nominees have overcome barriers to engage team members in providing care, creating a healthy team culture, managing conflict within the team, strengthen care coordination internally and in the community, and achieve optimal scope of practice for all team members. So those are just some of the examples of types of achievements or features of the nominees that we'd be looking for. And that is in the description. For number 4, measuring performance to foster improvement in comprehensive care. This is looking at measurement and the systems in place to pull measures and data out of your EMR and clinic. But looking at what you've done with the data, so if you've seen a gap or been able to identify a population within your roster who hasn't, who needed to be able to I'm going to use cancer screening as an example, who needed to increase their screening rates, then it'd be looking at what was the improvement that was taken from there.
Nadia was asking if you could explain category 1 again.
All right, so I will go back to number 1. If I should ask another poll question if I should go over those one more time. Hang on a second. Let me just hide this and come back to the categories so you see them in front of you. Number 1 is planning programs and fostering partnerships for healthier communities. And that's really looking at what is the planning process that was taken to develop programs or develop partnerships based off of the population community need, looking at the broader community. So in the description we say that nominees are planning for populations, improving health equity, reducing disparities, creating stronger partnerships with local health and community services, and collaboration between LIN and sub-LIN regions and health links. So those are just some of the examples of what could come through. I could go through these other ones in a bit more detail. Paul is starting to get other questions. No? Okay. Thank you for those questions. So we'll move on for now, and we can come back to this after I've finished going through all the filling in process, and then I'll open up the floor again for questions. So once you've selected your category, you're going to start writing. And the first thing, or maybe it's the last thing, it really depends on your writing style, is coming up with a title. What is the achievement to be recognized? And how are we going to be calling this achievement from now on? And just the only tip in writing that is you want it to stand out, so keep it really short and to the point. Anything that's a really long sentence loses its impact afterwards. That's a writing tip. And then you're building a brief description of the achievement and why it merits recognition. So again, just a reminder, all of these questions that are in the nomination form have a 100-word limit. In this 100 words, I'd really focus on describing why it fits the category that you have chosen and why your achievement is innovative. So that would be where you really focus on that description. You will have the chance to show your evidence, the actions you're taking, how you've included the multiple voices in other sections. In this first 100 words, focus on why it fits the category and why it is innovative. Tell us why. Next, you're demonstrating evidence of impact. So again, 100 words. Describe the evidence available to demonstrate impact of this achievement. This can be quantitative or qualitative data, can include outcome measures, evaluation results, research findings, etc. And you have the opportunity to send in supporting materials. I'm bringing up my notes, bear with me a second, around these supporting materials. We really want you to focus when you have 100 words to summarize what is the thing that the review committee needs to focus on to show for you that shows the impact of the nominee has made. And this is a very broad way of describing it because, as you can see, the criteria, the categories cover a broad spectrum of partnerships, internal team collaboration, program planning, patient care, leadership. The type of innovations that you might bring out really vary. So in that 100 words, tell us where to focus on looking for impact, and then send in supporting materials. And those supporting materials, try not to drown our review committee with them. Give them supporting materials, but tell them how to look at it and where to find the most relevant information. I know a lot of teams will send in all this extra information, but it includes almost entire program descriptions and all the promotional materials that they sent out, where really we want to see how do you demonstrate impact. So look at testimonials, look at what have partners had to say, look at the data to see where improvement has come from. And when you're summarizing it, look beyond the statistics and look at it from the human perspective. So what is the story that is being told? And what did the initiative do for patients, team, and or community? Or what did the person do? And how do they feel different now that their work is complete? sustaining and spreading, describe the actions being taken. There are 3 out of the 10 questions in the online form that focus on the sustain and spread function. So you can see this is where most nominations will really stand out from the pack. Everybody is doing absolutely excellent work. All of the primary care teams have incredible innovations, incredible projects, and are definitely showing evidence of impact. Where you're going to be shown above the pack to really be recognized as a Bright Light Award winner is what are you doing, the nominee doing, to sustain and spread, to keep it and to share learning and with other primary care teams. So you'll see the 3 questions there. They're very explicit as to what they're asking for. Afterwards, I'm happy to go back and answer any questions you have around this, but again, take some time to think this part through. Including multiple perspectives and voices. In the evaluation criteria, I said we're looking for how the nominee recognizes and addresses the needs of their local population, and how you include the patient and or caregiver voice. So there's 2 separate questions in the form from those 2 topics. It really depending on how your program or initiative or the nominee has built up their work. You might need to address this before you start talking about sustaining and spread or afterwards, but there are 2 questions in the form to focus on those 2 elements. And then a reminder around the supporting materials. All supporting materials are due by July 12th, so you have to send in your online form and the supporting materials for evidence of impact or testimonials or whatever that might be by July 12th. And I put in onto this slide a couple of tips of what type of information can be included. So evidence of impact, quantitative or qualitative data, any media, local or otherwise, coverage about the initiative that is already shown up. Show how, and the verb there is really important, show how patients, team members, partners, and stakeholders have benefited, either from their voice if they're willing or able to provide testimonials, or a very clear description of what has changed for them. So at that point, that is the online form and just the entire process to go through for filling out a nomination. I want to open the floor up to you and ask any questions that you might have. So again, you can send them in through the questions panel or raise your hand and Paula will unmute you so you can ask a question out loud. We're not getting any questions now, and didn't do a time check to see if I've 12:33. 12:33. I kept to my half hour. I do want to give you the chance to ask any questions you might have to me, or if you feel more comfortable, to take this information, digest it, and start to build your nomination. And we're happy to answer any questions that come up after the fact. But this is your opportunity. Okay. No, dead silence in webinar is not great. So if there aren't any questions, if you do have any, please feel free to send them now or afterwards. We're happy to answer any. And if there are none, I will close the webinar. And nice and short. I hope everybody can enjoy that. And with just a reminder that the deadline to submit nominations is July 12th. The online form is available. Click through it, see if you have to get a feel for it. We also have resources that were sent out with the call for nominations. One is the nomination guide, and in this guide you will see all of the writing tips that I just went through on the webinar, the category descriptions with very specific topics or ideas that the review committee will be looking for. And then we also have a nomination form template. So one thing I always say whenever you're submitting an online form, we use SurveyMonkey. It doesn't save your data, so fill it into this Word document so you have a copy that you can send it through everybody who's helping and collaborating in building this nomination before you actually submit it to the form. And then again, don't forget, every nomination we do want the photos so that we can really feature everybody's achievements, not only the award winners, at the dinner and beyond. So the photos are due by July 29th. And if there's any questions around how to do that, let us know. So Paula, if any questions come in while I was doing that?
Just a thank you.
Just a thank you. Okay. Well, thank you everybody for coming and joining us. I hope this was very helpful, and I hope to see all of your nominations coming in by the 12th. Thank you all.